Hello everyone, and welcome to the webinar this afternoon. I'm really pleased to be here. It's just to let you know a bit about those of you that don't know about Overcome Support Services. So I'm the head of support for Overcome, and if you contact us, we're available Monday to Friday, 10 AM to 5 PM, and there's a variety of ways to get in touch with us, either phone, email, text, instant chat through the website, Skype. We can set up Zoom calls as well if you're happier with that technology. And please do get in touch with us. We're here to support you and anyone affected by ovarian cancer. So that's friends and family as well. And we're happy to talk about absolutely anything that you want to talk about. So there doesn't even have to be a question. If you're just having a day where you just need to talk to someone, then please do get in touch with us. And it will be me or my colleagues, Julia and Laura, that you speak to. And all of the details of ways to get hold of us are on our website. But I'm delighted to welcome Sam Evans. She's done webinars for us before and spoken at our health and wellbeing days, and her talks are always really informative, really popular. We get great feedback, and I know how much it's valued by the community. So I will hand over to Sam and say welcome.
Hi, thank you very much, Alice and Anna, and thank you for inviting me again. Just a little introduction about who I am. So I'm Sam Evans, and I'm the co-founder of Joe Divine, which is an online sex toy retailer in the UK. We only sell skin-safe products, so that's our sex toys and our sexual lubricants. I run the company with my husband Paul. We've been doing it for the last 12 years. I have a nursing background, so I've actually used my nursing experience to write practical sexual health and pleasure articles for anything really, but about sex after cancer, including ovarian cancer. I'm really passionate about this because I feel that people do not get the right information when they're going through treatments or post-treatment, and I speak to quite a lot of people on the phone or face-to-face to help them actually regain their sexual function so they can actually enjoy pleasurable sexual intimacy with their partner or on their own, and whatever that may be for them. So for me, it's actually giving people the practical information to help you step back into sex, because we know it can be quite frightening. You worry about it hurting, you worry about the fact you've got no libido, you worry about intimacy with a partner. Partners are impacted upon as well. And there are simple things that you can actually do to enjoy sex after treatment that are inexpensive, that you can do in your own home with a partner or alone. So I'm just going to sort of run through the things that are very common. We've had quite a few questions, and some of them have obviously covered the same thing, and hopefully I will cover the information that people have actually asked, or the queries that they've actually asked us, but obviously we will go through the questions afterwards. So the first thing for me, when you've actually been through treatment, is your intimate health. It's actually your vagina health, and it's something that is really important once you've gone through treatment, whatever that may be, because changes happen in the vagina. And what happens is the decreasing or depleting estrogen actually causes the vagina to shrink. It's less well lubricated with your own natural lubrication. And so it shrinks, and the tissues and the skin become sore and tight. So you get vaginal tightness, you get decreased sexual sensation, and obviously you've got vaginal dryness. All of this can make any form of penetrative sex feel painful or uncomfortable, but also any sort of mutual masturbation on your vulva, on your clitoris as well, because the tissues there can shrink too. So the really important thing is to look after your vagina health. And obviously people ask us, the first thing people say to you, vaginal dryness, go and get a lube. What do you buy? Oh, a tube of KY from the supermarket. No, please don't. Lubricants are not all the same. The ingredients in lubricants can be very irritating, and I know at Overcome we recommend yes, lubricants, organic lubricants, and they are available on prescription, the water-based formulation, and they also do a vaginal moisturizer. They're both available on prescription for you. And then there's an oil-based formulation too, and you can use the water and the oil together. So you put the oil on first, then the water on, and it creates a double glide effect. They also have an anal lubricant too, and that's designed for anal play. It's a water-based formulation. And there are other products out there that are skin safe. So the first thing you should be looking for in a lubricant is that it's free from glycerin. Glycerin is a sugar, and that will cause thrush, and you are more prone to thrush once you've been through cancer treatment because of the depleting estrogen. Glycols, they're really well-known vaginal irritants. They irritate the skin. That's actually what will make a lubricant sting when you first put it on, and people go, and actually it's not just somebody with a vulva or a vagina, somebody with a penis too. And it's actually often what puts couples off from using a lubricant. Also parabens, they are a preservative, they are estrogenic, and obviously we shouldn't be using those inside our bodies at all. You've got the ones that warm you up, cool you down. The warming lubes contain the similar, what you would find in chilies, and the cooling ones generally contain menthol. Now some people really like those, but if you've got sensitivity already, it can actually cause more irritation. You've got ones with glitter, because we always need a glittery vagina, don't we? And obviously flavoured lubes, they're great for oral sex, but they're not great for any form of penetrative sex because they generally contain sugars or sweeteners, and actually that can promote the growth of thrush as well. And obviously some lubricants aren't pH balanced to your vagina, which is 3.8 to 4.5. So they disrupt the pH, and then that can lead to bacterial vaginosis, which is like a fishy smelling discharge, and you need antibiotics for that. And then also osmolarity, that's water-based lubricants, and I'll talk about the different types of lube. That actually, some products are hyperosmotic, so KY jelly, well-known lubricant on the high street, available online. One's even being prescribed by GPs too. They actually exacerbate vaginal dryness. They will draw the moisture out of the walls of the vagina, and they will actually exacerbate any sort of dryness or irritation or atrophy. A lot of the lubricants that are out there, a lot of the treatments out there are actually short-term fix rather than a long-term fix. And this is the thing, these things are for life. You know, you're going to be using them for life now, because I'm personally owning a sex toy company. You know, using a lubricant is one of the best things you could possibly do to transform your sex life, but you need to use a really good lubricant. I've written about my own experience, because for me, KY and Durex lubricants destroyed my sex life in my 20s and 30s, and I've been passionate about this. So that's really important. So the lubricants, you've got water-based. That's great to use for any form of sex play. It's safe with condoms. It's safe with all sex toys. And it's the one that's closest to your own natural body's lubrication, but it's not quite as long-lasting as some lubricants. Then you've got oil-based lubricants. So the yes, oil-based is great with our sex toys, but you can't use it with condoms. And also when I talk about oil-based lubricants, I'm talking about things that are designed for your vagina, not your coconut oils, not your olive oils, baby oil, whatever oil out of your kitchen. You know, these things were never ever designed for intimate use. They will cause irritation and disrupt the pH of the vagina. So that's really important. Again, that's something I've really written about. Vaseline, that's another thing that people get advised to use with their dilators, and please don't. And then there are silicone lubricants. So these are a little bit more slippery, and they're great for longer lasting sex play, but they're not advisable to be used with silicone sex toys because it will damage a silicone sex toy. So if you're going to do that, you can either pop a condom on it or obviously use a water-based or an oil-based lubricant. But it really is about finding what works for you. So I can say I use these lubes, but you might find that it doesn't work for you. So you have to be a bit of a detective, really, and that's important. And then vaginal moisturisers. So like we moisturise our face every day and our bodies, we should be moisturising our vaginas just to keep everything happy and healthy. And again, we've got so many out there on the high street and on prescription. It's all to do with ingredients. It's to do with pH. So the Yes Vaginal Moisturiser is great. Use that every sort of 3 days or so, and you're just maintaining the pH of the vagina and keeping it happy and healthy. And that will actually help with sex. But it's a matter of playing with lubricants, finding what works for you. If something's got glycerin in it, it will feel tacky. So be a detective and actually check the ingredients. But be aware that some well-known lubricant brands don't put the ingredients on the packaging, which is quite frustrating. And then if you're using condoms, then also be aware, people think that they're often allergic to condoms, but they're actually allergic to the ingredients in the lubricant on the condom or the lubricant that you're using with the condom. So, you know, we sell Skins condoms, which actually have silicone lubricant on them. So again, it's being a detective, finding ones that actually work for you as well. So that's really important. So that's your vagina dryness, vaginal atrophy. Obviously, some people may be able to take local estrogen. That's what you have to talk with your doctor. It's about quality of life, you know, and quite frankly, you know, that's something that the oncologist or your clinical nurse specialist can discuss with you. And I know Dr. Louise Newsom has done webinars about this too. And also the other thing as well, can you ditch all those feminine hygiene products, put them in the bin? You don't need to wash your vulva or your vagina. You can't wash your vagina anyway because you can't get up inside there. But, you know, you don't need these intimate washes. If you are noticing irritation or itching, you really need to get that checked out by your GP. Don't go to the chemist and assume that it's thrush. Thrush is so over diagnosed, and it's actually not thrush. There could be other things too. And using Canesten could actually exacerbate whatever itching you've got. But check what you're using. You know, if you're using shower gels or you're using, you know, bath bombs belong in the bin. They really don't have any place in our baths at all. They're terrible things. But we've got so many things now that are being thrown at us, you know, so sprays and douches and wipes and washes. Just be a detective. You really don't need to use those things. Use water. If you feel you need to use a wash, then you can use a gentle emollient, and you can get things on prescription from your GP or over the counter at the pharmacy. They are gentle products that have been pH balanced, but just be really careful about what you're doing, and you know, and don't start scrubbing yourself with the shower gel, or, you know, because you don't need to do that. Your vagina is self-cleaning. Don't know if there's any other questions from that about your vaginas and your vulvas.
Okay, shall we make a start then, Sam, with the questions that have come in advance?
Yeah. Your feelings of sex will come back. It's just a matter of finding out what works for you. Little steps. So don't think that you've got to go in all guns blazing with penetrative sex. This is something that we hear really commonly when I advise people and I give talks to people who've been through cancer, is that the partner is scared. They're scared of hurting you, and that is completely understandable. And also, if it's somebody with a penis, they will probably lose their erection because of that fear, and that's very, very natural. So actually, you know, it's actually about finding things that work for you. Take the focus off any form of penetration, because sex is so much more than that, and lots of people don't have penetrative sex, and they're having amazing sex lives. And so basically start with a little steps. So I would say kissing, cuddling, you know, touching, massage, all those things that you can do to sort of fire up that intimacy and those sexual feelings. And also about the way you feel about your body too, because obviously things have changed and a lot of people don't feel like a sexual being. You've been through medical treatments and actually you can feel so medicalized and not sexual at all. But those are things that you can do with a partner and say to them, you know, well, actually, I quite like you to touch me in this way. That's not going to hurt me. That's the important thing, is for you to go off and explore yourself. So get yourself some of the, you know, a good lubricant. I always say to people, a simple bullet vibrator, you know, and start exploring your clitoris. Go off into the bath. These are waterproof. This one looks like a lipstick. A lot of our toys are waterproof. And actually start enjoying some orgasms in the bath on your own. And when you feel confident, you can say to your partner, well, I've actually been using this little bullet. Could we use it together? This is how I've been using it. And also you can use it on a male partner too. Obviously you can use it on a female partner, because you can use it up and down the shaft of the penis, underneath the testicles, on your nipples. You know, there are so many ways that you can use this simple little toy, but you're not having penetrative sex, and actually you're slowly building up to that. So once your partner realizes if they touch you in a certain way, that's fine. Make noises if it's pleasurable. Obviously if it's hurting, tell them to stop. But there are things you can do that you don't have to have penetrative sex to begin with. These are the steps that you're taking back into getting back to penetrative sex, if that's the way you actually have sex. But those sexual feelings will start to come back. And if you explore different things that maybe you've never done in your relationship, you might find, oh, I really, really like that. And I would say to people, maybe try blindfolded sex play, because being blindfolded actually heightens your senses. So your sense of touch, smell, taste, hearing. You know, it can be a lot of fun doing it on a partner, or having it done to you. If you don't quite know what's going to happen, obviously you've got to trust that partner. But, you know, it's a lot of fun because you'll then focus on that area of your body that's being stimulated, and then that can feel quite arousing. You know, so it's a really, really fun thing to do, you know, with a partner, to actually help boost your, you know, the feelings of sex, and help them come back. But don't think you've got to go in all guns blazing and have sex play. The important thing is talk to your partner and show them what you've been doing or what works for you, and say, can we try this? Would you like to try this? This would be a really good idea. I've been trying this. This has been working for me. So I hope that's answered your question. so we've covered the lube. So basically, you know, as I said, ingredients, there's loads of information on the website, and you've got it in your literature too at Overcome. But again, that fear of intimacy, I think if that is actually ongoing, it would be really worth talking to a psychosexual therapist. I know that some cancer centres actually offer that service, and that would be really important. Either go on your own or go with a partner, because you'll probably find that your fear of intimacy is the same for your partner, or they might not understand why you're feeling like this. And most people go, I had no idea you were feeling like this. But once they know, then you can work together and you can talk with each other. So I think that fear of intimacy is a really, really important one. And I do feel that there is a place for psychosexual therapy, you know, either in the NHS or private practice, that actually can really help you realise what's going on. And because also it's not just physical things, it's a psychological thing. You've been through a huge health experience that, you know, no one ever wants to go through, but actually you've come through the other side, and actually it's both, you know, your emotional and your physical well-being. So we need to be looking at both of those, and it could be that you can do physical things that I suggest, but also talking to a psychosexual therapist who actually can help you. And there are ones also who are, as I said, attached to cancer centres and units, but also there are ones who are trained, you know, they will say on their bio that they actually will help cancer patients. So that's really important. And also there's a College of Sex and Relationship Therapists. I'm sure you've got links at Overcome, so people can find therapists through that as well. Yep. So what I talked about was the vaginal atrophy. So when obviously the estrogen disappears from the vagina and also the bladder and the urethra, you get this shrinking, and then obviously the vagina shortens. When you've been through a hysterectomy, your vagina shortens as well because the ligaments have been cut, so it sort of drops down a little bit. That can make penetrative sex feel painful. So, you know, the important thing is use lubricant, and we've talked about that. The second thing is maybe look at positions that aren't, you don't have deep penetration. I have a history of vaginismus, so my vagina tightens up, and for me, learning that being on top, I can control the depth of penetration with my partner. You may find that sort of being in a snuggly position, spooning, that's helped because the penis isn't going in so far. You know, anything that you can actually control the penetration. And also there are things like the O-nut, and there are other things like that the partner can put on their penis, and it will actually sort of shorten the penis because it acts sort of as like a bumper on a car, and basically so you can't actually be penetrated too deeply. And then the other thing is obviously dilators, and there are a lot of you get given just these plastic dilators with no instruction. Go home, go and dilate, and a lot of people really, really struggle with that. We actually have the silicone dilators here, which are the Inspire dilators. As you can see, there are 5 of them, and they're incredibly flexible. And there's obviously that one's the size of your little finger, and that one's great basically just if you are worried when you're first starting off, and to massage around the entrance of the vagina, because that's obviously where the tissues can actually shrink. Occasionally people might find that the tissues split, so massaging it with a bit of the oil-based lubricant or moisturizer can really help. And also, you know, it's a good one to start off with, and obviously then it goes up to this one, which would be the size of an average penis. If you have got a partner who is more well endowed, and obviously they may be using a sex toy that's a bit bigger. I know I've got one lady who's managed to achieve pain-free sex after 5 years. She's been working her way up our toys. So it's actually, you know, you just work your way up basically with the dilators. You just basically pop them in as you are able to, and the idea is that you breathe out to relax your pelvic floor, and you can leave them in, you know, a few minutes to begin with if you can tolerate it. People say sometimes that they sit in front of the telly while they've got the dilator in them. You know, it's basically, it's really important that you do continue with dilation, and people give up because of the plastic ones that they give out on the NHS. Unfortunately, they're not the most comfortable. And the other thing that you can actually do with the dilators, this is our slimmest toy called this is the Slinky Karma Blue, and basically it's a little bullet powered vibrator, you can see here, and it's got a silicone sleeve, and that's a great one. That actually goes between dilator 2 and 3, but it also fits through the handle of the dilators, so it will send vibrations through this. Now, Vibrations stimulate the blood flow inside the vagina. It helps to keep happy and healthy. It promotes lubrication. It helps with sensation, certainly when you've been through surgery, and it helps with, you know, if you've got decreased sexual sensation. So not only can you dilate, but obviously you can use that on your clitoris, you can use it internally, you can use it on a partner, you can just have the bullet here. So it's a bit of fun. It's an inexpensive toy, but it's a good way of actually sort of stepping back into feeling a bit sexual while you're dilating too. And the other thing as well is your pelvic floor. So, you know, a lot of people actually following surgery might end up with a tight pelvic floor. So therefore seeing a pelvic health physiotherapist can really help. They can teach you to learn to relax your pelvic floor. I know I was telling people to have a tight pelvic floor to stop us from having incontinence, and it helps with having better orgasms. But actually some people end up with a tight pelvic floor. And obviously when you come to have penetrative sex, if you think that sex is going to be painful, you're going to tighten up. It's a natural response, and therefore penetration will feel painful or it won't be possible. So that's really important. So using, you know, slim sex toys can really help as well. We have the health brochure, Joe Divine health brochure, which we created in the NHS, which has got slim sex toys in it. It's got dilators, it's got clitoral stimulators, because obviously we recognise people have decreased sexual sensation, pelvic floor exercises that some people like, and obviously the yes lubricants as well. And there's an article on the website with me doing a video talking about the products that are actually in the brochure. But there are different things that you can actually do to help stretch the vagina before any penetration. Some people actually sort of might even use this before they're going to have sex, make it part of their sex play. They might grab themselves a sex toy. It's not a spatula, it is actually a sex toy, bends in the middle. So this goes inside you, this stimulates your vulva. So you can have dual stimulation, or you could just use it separately as well. It's a funny thing, it's called the Marvelous Lover. But there are so many things you can do to actually play with a partner to actually prepare yourself if you are able to get to penetration. But those are the reasons why you end up with vaginal tightness. So it could be that you've got medical dilators from the hospital, or you could just buy yourself a simple sex toy and use it in combination as well. And again, if you're still experiencing problems with vaginal tightness, it might be that you could go and talk to a psychosexual therapist, because you may have a form of vaginismus whereby the pelvic floor is tightening up, and they can teach you exercises to help you relax. Basically, if you remove the estrogen from your body, it's a sex hormone, then yeah, your libido will drop. I mean, some people obviously can take hormone replacement therapy. Again, it's something that you need to discuss with an oncologist. Obviously, a lot of people can't because they've got an estrogen receptive cancer. And basically, some people can take testosterone. It's not a quick fix though, and it doesn't always work for a lot of people. And we do struggle in this country having it on prescription. It's not licensed, and often people have to go through a private menopause clinic, or, you know, it depends on where they live in the country. And again, with the whole libido, it's to do with that mind-body connection. It's how you feel about yourself. You've been through cancer treatment, how you view yourself, the fact that your ovaries have been removed and you're no longer this reproductive person, though we're not just reproductive people. And that is another thing too. So again, psychosexual therapy can actually help with that. But all the little things that I've said about using the lubricant, masturbating, using a sex toy, can really help. You know, even if you don't feel like it, grab your little bullet, go off into the bathroom and have a little bit of a play. It will start sparking some of those sexual feelings, you know, and it will help things start to come back. But, you know, it might not come back to what it was. It might be different. And this is the thing, I think it's actually accepting that things are going to be different. They could be even better if you discovered that you love sex toys, or you love bondage, or you love kink, and, you know, you've actually discovered a new way to enjoy sex. But it will come back. It's just those little steps that you need to do, because a lot of people say, I just don't want to have sex, I don't want to be touched. But if you just sort of start with the kissing, the cuddling, and explain to your partner that this is how you feel, because the vast majority of partners will understand. But just so you know, libido isn't just about sex, it's about that look that you do to your partner across the table. It's about kissing, because our lips are so full of nerves, and actually that can trigger lots of sexual sensations. It releases dopamine and oxytocin. Dopamine is a feel-good hormone. You've got oxytocin, which is like a bonding hormone, and that is also something you release when you have orgasms, and it makes you feel happy. You know, there are so many things that you can do, and touch as well, as I said about blindfolded sex. Basically, you get a feather, get a silky rhythm, maybe some velvet or some silk. You know, you could even get yourself, you know, a tickler or something, and actually enjoy sensate pleasure, because it's actually stimulating all the senses that will hopefully stimulate some sort of sexual feelings. But if it's continuing, then I would say seek psychosexual therapy, because they can actually help you as well, in addition to trying some of the things that I've recommended here. Really, when I read this one, my first thing was, you do really need some psychosexual therapy. They are the trained professionals, and they will actually be able to help you. Obviously, I can give you practical tips and advice, but if you're not feeling sexual, you're not going to want to whip out your bullet vibrator and go off and use it in the bath or with a partner. The important thing is to talk to your partner. I know it can be really difficult. And again, you can either have therapy on your own or with your partner, or they may want to have therapy on their own too. But I do think that has to be your first starting point. I do think that, you know, yes, you could try the lubricant and try and masturbate, but if you don't have any feelings, it might not trigger anything, you know. So I do feel that psychosexual therapy has to be your first port of call, really, before you try and implement these practical things to help you. But as I talked about, you know, it's not just about penetration. Obviously, this practical tips can help you, but a sex therapist, a psychosexual therapist, will really be able to help you overcome that fear, the fear of intimacy, the fear of pain, the way you feel about yourself now. You're no longer a sexual being, that you feel like you're this medical, you know, person, you've been through this medical treatment. And I hear that an awful lot, that people feel like they've been medicalized by the cancer treatment, which is completely understandable, and they no longer feel sexual. And also the type of cancer, you know, it's your sex hormones. That's what's happened. Your ovaries have been removed, and they, you know, they produce estrogen, and it's, you know, that they are your sex hormones. So I think for you, it would be really important to seek out psychosexual therapy, and either on your own or with your partner. But try and have conversations with your partner too. I think that's important, to explain to them how you feel. And you can still try the kissing and the cuddling, because that still is that connection. The important thing is about intimacy and the connection that you actually have with your partner as well, you know. And don't feel you have to go through sex. Don't think you have to go through the motions of doing it. No one should ever have to do that. That's why it's important to actually seek out psychosexual therapy. Obviously, I'm not a menopause expert, and I know Louise Newsom, Dr. Louise Newsom, has provided information about that, so I can't give any information about medical alternatives to HRT. But you can use, yes, vaginal moisturiser, and you can use, yes, lubricants. They are non-hormonal, and so these actually will help in some way. And actually, some of you may be able to use local estrogen, because it's not absorbed into the bloodstream, it's only absorbed into the walls of the vagina, but that's something you have to talk to your oncologist about. So it's actually going for the non-hormonal moisturisers, the lubricants, you know, and actually using a simple sex toy or a dilator, and actually, you know, that will actually hopefully improve, you know, the quality and the health of your vagina and the symptoms that you're actually having, because you're nourishing the tissues. It is difficult, and it's hard sometimes to use just non-hormonal products, but they can help to a certain degree. So, you know, and obviously there are alternative medications that you can actually have to HRT. So again, it's talking to your oncologist. And as I said, Dr. Louise Newsom, who's my menopause doctor, has got loads of information on her website too, and she's done webinars for Overcome too.
Yeah, and they are on our website if people want to view them.
I just want to say to you, I'm so sorry that you've actually been through this experience, because it's really, really heartbreaking to read. For you, psychosexual therapy is really, really important, obviously, to help you with what's happened in the past. and it's triggered, obviously your attempts to have sex has triggered all those memories coming back for you, and as soon as it triggers anything like that, your vagina is going to tighten up, because any thought of pain or anything about, you know, a sexual assault, it's going to cause problems. And you also mentioned that you've been given these plastic things by your nurse. Well, basically you should be shown how to use them, and I think what would be really useful for you is to actually, if you're able to, see a pelvic health physiotherapist, take your dilators with you, and they can actually talk you through how to use them. These people are amazing. They know so much about the pelvis and the vagina and the vulva. And I think actually having that sort of treatment would really help you to, you know, get to the point of being able to have penetrative sex with your partner. But you talk also about the fact is you've lost sensation in your clitoris. And again, if you feel you're able to, then use a sex toy. Now, obviously, I've talked about vibrators, but sometimes people find that vibrators don't work for them on their clitoris. So we have like air pulse toys, and this is the Sona, and it uses sonic wave technology. So you put that over your clitoris, and what it's doing, it's not a vibrator, it gently teases and caresses the clitoris. And what you see on the outside is just the tip of the iceberg. The clitoris, oh, I didn't bring my model, but I've got a model of a clitoris, and that is sort of a horseshoe shape. It goes around the whole, the vagina itself. And so basically using this will stimulate that clitoral tissue. We do know that people are enjoying this toy and sonic air pulse toys because they're different to vibrators. And we know that people are struggling to orgasm are having an orgasm with these toys. And what it's doing, because it's stimulating that clitoral tissue, it also promotes the blood flow into the clitoral tissue, and then that stimulates sexual sensation. It stimulates all the nerves that might have been impaired by surgery, and actually that will hopefully then enable you to have an orgasm. And obviously with your partner losing his erection, as I've mentioned before, this is really, really common because they're worried about hurting you. But obviously we have toys for men, so if you wanted to play together beyond penetration, then you can get, you know, a toy for yourself, and he can get a toy for himself. You know, there's this fabulous toy here. It's called the Pulse. It's a male vibrator. This one is great for couples to use because the end of it vibrates too. And so basically a guy can put his a penis in there and turn it on, and either use it as a masturbator with a bit of lube, just leave it in place, and then a partner can either be underneath or sit on top, and then you can get clitoral stimulation, so you can stimulate sexual intercourse. So those are things that you can do, but really psychosexual therapy for both of you, and pelvic health physiotherapy would be your starting point to get back into enjoying sex, because obviously your history means that there's so much more going on than your cancer treatment. But you will, you know, the help is out there. So using a combination of treatments, so therapy, pelvic health physio, dilation, using a sex toy, good lubricant, these things can actually help you get back to enjoying pleasurable sex. And so don't give up, because there are things you can actually do, but it's actually a matter of process, and it can take a little bit of time, but you may find that, you know, the therapy could help you with the physio as well. And once you actually know how to use your dilators properly, then you might feel more confident about using them at home. So I hope that's answered your question. And going back to a normal sex life, as I said, it might be different to the sex life that you had before. You know, might be more fun, might be more pleasurable, might have more sex toys. It just might be different. And I think you actually have to acknowledge that that happens. I know from the research, and I've written about it on the website, a lot of people only focus on penetrative sex, and once somebody's been through a cancer treatment, they then have to be creative with their sex life, so then they enjoy sex more because they're doing different sexual things that I thought, I didn't realise that my nipples were, you know, it felt so pleasurable. I didn't realise I had this patch on the back of my neck or the back of my knees, or, you know, oh, it's an erogenous zone for me. I didn't know that actually makes me feel, you know, that shiver when someone breathes on your ears. So I think that's the really important thing, is actually you explore things beyond perhaps what you've done before. And obviously if you're single as well, you know, the important thing is that you enjoy sexual pleasure on your own and whatever you're doing. And not everybody's in a relationship, not everybody's in a permanent relationship. So, you know, again, if you're not, then, you know, whenever you're going to have some sex play with a partner, make sure that you whip out your lubricant. And if you're going to wear it, use a condom, use your lubricant, and say, well, I'm going to use this lube because it just makes sex feel pleasurable. You don't have to give an excuse. You don't have to tell people why you've got to use it. you know, just say, I quite like to use this lubricant, you'll find that it actually makes sex feel really good and I really enjoy it. You know, so that's another important thing to say as well, because I know we're talking about partnered sex here quite often. But again, somebody who's single, you know, you will want to do the dilation too, because hopefully whatever sex you want to do, you'll still need to have a viable vagina. So, you know, if you ever need to have a pelvic examination, then, you know, because often this is where people find that it can be quite painful if they do need to have a pelvic examination because things have got tighter.
Thanks, Sam. We've reached the end of our questions that were sent in before, but I can see we've got one in the Q&A box and one that's come up at the side, so I'll read those out, and do send in any other questions that you've got as well. So this is the first one that's come in. Someone said, we keep talking about people who have gone through cancer treatment and are on the other side, but many with ovarian cancer are having ongoing treatments, i.e. I've had surgery and chemo and I'm on a laparib and I'm due to have a double mastectomy later this year. I will be having treatment for the rest of my life and I'm in my early 40s. Do you have any advice for coping with anxiety caused by current or future treatments? I'm thinking more of the psychological impact than physical barriers.
I think that's something, again, psychosexual therapy has a place for you to actually talk that through with somebody and find out if your cancer centre has actually got a therapist who can actually talk to you. It is difficult. You're going through a huge amount of changes. The psychosexual changes, the way your body has changed. If you're going through a mastectomy, and obviously the breast is seen as sexual, but you're doing it for a reason, you know, to prevent, you presume you've got the BRCA gene, and it's quite difficult. I mean, obviously I've written an article about sex after breast cancer, but actually talking about the way in which we perceive ourselves, you know, again, it's all to do with that psychological connection and how we feel as a sexual as a woman. And as you were saying, you know, you're young and you're going to be living the rest of your life with this. So I do think that you need to talk to a therapist about your feelings and seeing if there are coping mechanisms that you can use, can implement into your day when you do feel the anxiety, the overwhelmingness of everything that you've gone through. And obviously I can offer practical advice, as I have done, but I do think you need to talk to somebody because they can teach you different ways of dealing with that anxiety when it hits you. You know, so I can't really offer a lot of advice in that respect because I'm not a psychosexual therapist, but I know that they do a huge amount of work in this area. So, you know, that is something that's really important. I do feel people should have psychosexual therapy or, you know, therapy after treatment or when they're going through treatment or alongside treatment. As you're saying, you're going to be taking your treatment for the rest of your life. And I do think that this should be something that should be offered. I know it is offered in some places, but not to everybody. So again, maybe we don't have enough psychosexual therapists, I don't know. But we do have therapists out there. I work with quite a lot of them who can actually help you develop coping strategies. And I think that's the thing about it. You need to be learning what works for you, because what works for you might not work for the next person. So, I'm sorry, I can't answer the question in any other way because I feel like it's a bit beyond what I'm able to do. So.
Thanks, Sam. So another question. Since recovery from surgery, I've not been able to achieve orgasm. Does that mean the nerves have been damaged, or is it due to the reduction in hormones? Can it be improved?
Probably due to the fact that your estrogen levels have depleted, and also maybe the, you know, yes, whatever surgery that has happened, but actually you can stimulate those nerves. So as I talked about using a sex toy, as I talked about using the sonar, or, you know, I mean, this is a massive toy here. This is actually a mains powered body massager, but it is great for intimate massage too. You might find that you need a stronger vibrator or sex toy to stimulate those the nerves, because also you're going to stimulate the blood flow as well. And you know, it's actually finding out what works for you and taking your time. And I think if you're constantly thinking, why am I not orgasming, why I'm not, you need to switch that off in your head and just focus on what feels pleasurable in your body. But again, the air pulse toys have actually been, you know, they've become a bit of a game changer within the sex toy world. They're fairly new, they've been around for a few years. And we've got lots of different designs, but I do know they are really helping people who are struggling to orgasm because they're not a sex toy, they're not a vibrator rather. They work in a very, very different way. So yeah, and those nerves, you can stimulate them, and they are, well, hopefully, you know, what you're going to do is try and fire the nerves, so you're actually going to get sensation back. and the sensation might not be quite the same as you had before, but you know, it could be different sensation. But you know, I do think by viewing sex toys and lubricant as tools to help you regain your, you know, sexual function, to help you have an orgasm, they can be a really, really good thing to do. And they're a pleasurable thing to do. There's no side effects to them if you're using a good lubricant. You know, and all our products are skin safe. All the materials have been tested, you know, so we know that they're safe to use inside the human body as well. So I think if you view it in that way, using, you know, trying to find some sex toys that actually work for you to stimulate that clitoral tissue, so you can fire up the nerves, because obviously, you know, if you can't take estrogen, then you can't take estrogen, so your body's not going to have estrogen in it. But these are other things that you can actually do and have a bit of fun, because that's the most important thing about it. So there's loads of information on my website, joedivine.com. And there is an article about sex and ovarian cancer, but there's articles about sex after hysterectomy, you know, why am I struggling to orgasm? There are so many things. We've got videos as well on YouTube. We talk about toys, but we talk about other things as well. I'm available on the end of the phone. I'm always happy to give people advice, you know, and I'm happy to talk to you if you want to call me a few times, if you're not sure about toys. All calls remain confidential. If I'm not around, somebody will take a message and I can call you back. You know, so, and I am a former nurse, so I do obviously understand some of the stuff that you've been through, but obviously I've not been through cancer treatment. And also we have a code for you as well. So if you did want to order anything, so say you want to order the Dilator kit or a toy, we have the Overcome 2020, and that's going to be available to the end of September. So that's the 30th of September. You get 10% discount, and it's a minimum spend of £15. But you know, just have a look at the website. You haven't got to buy a sex toy, but obviously think if the sex toy or the dilators are going to help you, or a tube of lubricant, then, you know, obviously then do invest in that. But, you know, just have a look at the information, because there's lots of practical advice on there as well. And also links obviously to Overcome, but to other websites and people that I work with, psychosexual therapists, menopause experts. Well, they've got websites and they've got lots of information too about sex after cancer. So, you know, it is actually a resource. It's a massive resource. There's 400 articles on there, and we're just adding articles all the time. So, you know, I love talking and writing about this, as you can probably tell, because it's really important. It's important that you don't give up on your sex life. There are things you can do, and some of them are so simple, from just buying yourself a simple vibrator that looks like a lipstick. So, you know, there are simple steps that you can do to get your confidence back, so you can enjoy pleasurable sex and sexual intimacy and pleasure, and enjoy orgasms, and that you can overcome vaginal tightness and vaginal dryness, and you can improve decreased sexual sensation and that conversation with a partner as well, so that they can regain their sexual function too, and actually explore things that maybe you've never thought about doing in the bedroom or wherever you have sex, that might be a bit more fun too.
That leads quite nicely into our next question, actually. Sam says, please can you advise which sex toy would be the best one to start with to help with tightness and trying to start having sex again with my husband? I've tried to buy online and I feel overwhelmed with all the different types. I was given the plastic dilators and can't use them.
Okay, well, the first thing is say, why don't you give me a call, because that would be really good. Go and have a look at our website and have a look at the health brochure article, because there's me waving them around on a video, and you can then get some perspective of size. All our toys have the size that will have all the products are actually in the health brochure. But I mean, anything, it depends on what you're able to tolerate from penetration. If you're only able to get a finger in, then I would say the Karma, the Slinky Karma, because it is the size of your middle finger, and it's the one that people do start off with. And again, it's got the bullet, so it's sort of a 2-in-1 toy, and it's sort of, I think it's really good value. It's flexible as well. But then if you're able to get something a bit bigger, then obviously the Marvelous Lover, that, and then you can, you know, clitoral stimulation as well. I mean, obviously any toy that's designed for internal use that you can use on your clitoris anyway, and on a penis too. But, you know, we've just got different size toys, so it's actually what you're able to tolerate. You might want to work your way up. You might find that actually, well, no, I'm able to tolerate sort of, you know, a smallish toy, so this would actually be too small for me. So, you know, this is the one that we always, the Pico Bong Zizo, this is the size of an average penis. This is what a lot of people sort of use, or they try and aim towards. But as I've just said to you, that you know, you might end up having, you might have a partner who's a bit more well endowed, and obviously there is advice on the website if you do have a partner who is more well endowed as well, the toys that actually might help you. So, but you know, give me a call, because I'm always happy to chat to you, but also have a look at the website, because the information's there, and it's much easier, I think, sometimes to actually sort of get the perspective of the size of a toy. If I'm holding it in my hand, you can say, well, actually that looks okay, it doesn't look too scary, because I wouldn't want anybody buying a toy and going, oh gosh, that's just too big, and putting you off completely. Which is why we put all the size, we put in the circumference of the toy, we put the length, the insertable length as well, so you know how long it is. But any toy, you don't have to insert it completely anyway, so you use it in whatever way feels comfortable for you. So, you know, not one toy is going to suit you, it's everybody different. So, you know, if you want to give me a call, and I'm always happy to give you some more advice on the phone.
Thanks, Sam. And we've had a question about how do we find a good local psychosexual therapist. We do have links on our website to people who are like registration databases and things, and I can pass those to Alice, who can send it out with the webinar information follow up. But I don't know if you want to say anything else about that, Sam.
No, I mean, it's the College of it's the College of Sex and Relationship Therapists. They are the registered professionals, their professional body as well. We work with an awful lot of them. I'm happy to give people personal advice as well, but you know, if you go onto their database, you'll find somebody locally. Some work in the NHS, some work in private practice, some do both. A lot of them are doing online consultations at the moment. Some are starting to open up and doing face-to-face. But it could be that you might just need a couple of sessions, and it might just be worth investing. But it would be worth asking your cancer centre as well, you know, do you actually have anybody here? Because I do work with, and I know, off the top of my head, I know I work with somebody in Oxford, at Oxford Hospital, and she's a psychosexual therapist there. But I do have a Manchester, again, they've got psychosexual therapists. So it would be worth asking. Just be aware that there could be quite a long waiting list for NHS therapists, because we don't have enough of them. And if you are able to afford it, then it might be worth going down the private route, or you might have private healthcare insurance. So yeah, definitely. But you've got the information on the Overcome website that people can find somebody that is registered.
Great. Okay, we've got 8 minutes left. If anyone wants to submit a question, then please do. I've got a question that's just occurred to me, actually, Sam, as I was watching you lift the different toys and things. I was just thinking that with some of the smaller bullets and things, and if they've got lube on them as well, they're quite small and slippery. And for with some of the chemos, it's quite common to have peripheral neuropathy. So you've got altered sensation in your hands and can't grip as easily. And what toys would you recommend for someone who perhaps is finding it harder to hold sort of small items?
Yeah, I mean, this is a clitoral stimulator, so it's a bit bigger as well, but obviously this is a slightly bigger bullet. Obviously this can be used internally as well, so you might want to go for a bigger toy. To tell you the truth, I hadn't thought about peripheral neuropathy, and I should think about that. And the other thing is, well, you know, people must make sure that these are only clitoral stimulators, they're not designed for internal use. But obviously if you've got a small toy like the Karma, then obviously, you know, that is wouldn't be quite so difficult to hold. And obviously that can be used, you know, internally and around the entrance of the vagina too. So yeah, I agree that actually bullets, you know, it might be that you can't feel, you know, that. And I mean, you know, when also you don't want a sex toy that's all singing, all dancing 300 buttons on it as well, if you've got peripheral neuropathy, or if you haven't, you know, so something that's just got a simple bullet button control. And obviously we do battery operated rechargeable toys, depends what you prefer, and it's just something that's really simple, and you just press the button. I'll just turn that on now, and you know, and you just work your way through. A lot of the toys have different variations of speeds. A lot of the toys have pulsation patterns, so you might find that you find one that goes up and down, and a lot of those are quite good for edging towards your orgasm, or you know, and some of the toys, you know, are really sort of very, very low if you've actually got sort of, you know, you feel a bit hypersensitive as well. Some people can find that if they have their clitoris touched, you know, certainly after surgery, that it might feel it's a little bit, you know, and you want something that's really low. So the air pulse toys actually are good, because they actually start really low, and you can have them on the lowest setting and then slowly increase. So, and be aware that some toys, when you do turn them on, they come on high. I don't know why they create them like that, so you need to turn them down. But yeah, you're right, it's, you know, finding something that you can actually hold is important.
Great, thanks, Sam. Right, there's no other questions come in, so if anyone has a question for the last 5 minutes, then that would be, then now is your chance to get the question in. Right. And with the air pulse one, Sam, is that held in one place? So would that be another option as well? So
yeah, so basically these don't move. Yeah, basically you just lift, you've got to leave them in place over the clitoris for them to work their magic. I mean, there's this one here and there's this one, the Pro 2 as well. And obviously I don't think they're great for when you're having intercourse because you're going to knock it off, but they're great for sort of sex play together with a partner or, you know, on your own as well. And this is waterproof and, you know, and so you can use it in the bath or the shower. But yeah, you leave it in place. So again, if you've got problems with your dexterity or peripheral neuropathy, then you just leave it in place and let it work its magic as well. You know, so that's another really important thing, because sometimes vibrators as well, the vibrations can go through your hands and that actually can cause a problem too. So, you know, again, that's why they're another really good toy, just because you don't move them.
Okay, question come in. Have you seen it? So someone has said, I didn't realise the vagina's now shorter. Can I damage it with sex toys?
Only if you're using enormous ones, I think, and you're probably not going to be able to tolerate those anyway. You know, so as I said, this is the size of an average penis, so that's really what you're looking for. So you might find that you want to go for a shorter toy. And as I said, you don't have to penetrate yourself with the toy, as long as the toy. You don't, you know, this one you could just go that far. You know, and with the Zizo as well, you don't have to put it all the way in. You can just put it in as far as your body is able to tolerate it. But you will find that, you know, because of the way in which the surgery happens, there's a purse string at the top and it actually can cause the vagina to shrink. But you can actually stretch your vagina so you're able to have penetrative sex. So, you know, don't go out and buy a 6-inch dildo that's thick, unless you really want that. But, you know, you're not going to damage yourself if you're using toys that are actually a suitable size. And also skin safe. So skin safe silicone, glass, metal, ABS plastic, avoid rubber, jellytex, latex. They are porous, they degrade over time, they leach out chemicals. Some of them they perfume, so they actually they hide the smell of the jelly or the rubber, so you can't smell it. So that they perfume them. And also be aware of fake and used toys. There's a big problem now online, certainly from third-party sellers. So buy from reputable retailers like Joe Divine. You know, we've been doing this for the last 12 years. We only sell the genuine article. We only work with reputable manufacturers. You've got to be really careful about what you're buying. If it looks too good to be true, the price, it probably is. You know, so just be aware of actually what's out there and where you're buying products from, because we do have a problem with used products and fake products too.
Thanks. And is there a way to know if a supplier is reputable?
Well, I think you need to go to a retailer that clearly looks like, but you know, there are so many out there. But you know, that's the thing about it. The thing for me is if a website's got a telephone number, it's got an email address, and they've got an address, and you can actually contact the people. Some places you go to, it's a mobile phone number, or they don't even have a number, you have to email them. So again, you know, we've been doing this for 12 years. We know all the tricks of the trade that people do, but it's actually people who aren't sex toy retailers, but they sell sex toys on their websites. And we've got big ones that do that. So we do know there is actually a big problem, which is why, and obviously you can't phone up some of those retailers to ask them about their toys. You should be able to phone up the manufacturer, the retailer, and they should be knowledgeable like we are. We give a lot of information on the phone. But if they can't give you the information, they don't know very much about the toys, then I would sort of say, well, you know, just be really, really careful. That's the sort of really, really important thing to do.
Thank you, Sam. Well, we've nearly come to the end. Someone said a really informative session. Thank you so much, and I'll have a look on your website. And someone else has fed back that it's been really useful. So great. And just to say again that we will follow up with information and links, and that Sam is available. You can have a look on her website, and as she says, there's loads of information on there. And she's also available to speak with you on the phone as well and talk through things. Any questions that you've got about sex toys or things to try, she's available to talk those through with you. And so I said thank you, it's been very helpful. I can feel an expensive shopping trip coming on.
It's all going to be fun. It's all for fun, isn't it?
All right, well, thank you very much, everyone. And Sam, was there anything else that you wanted to add just before we finish?
No, so basically it's joedivine.com. I'm on Twitter, Sam Talks Sex, and the same as Instagram. It's joe.divine on Instagram. It's Joe Divine UK on Twitter. And we've got a Facebook page, and you know, obviously there's loads of information on the website. You can find the phone number, you can find our email address. If you wanted a printed brochure, then give me a call. I can pop one in the post, but the articles on the website with the videos and the toys are actually in the brochure. If you want one to give to your clinical nurse specialist, then please give me a call, or tell them to give me a call, because they're given out across the UK, these brochures, by healthcare professionals in all sorts of specialities, but in oncology departments too. So yeah, that's, and please give me a call if you want to, because I'm always happy to chat to you.
Great. Thank you so much, everyone.